أهلا بكم في تلفزيون CardioAlex. And with us, Dr. Mohamed Loutfy, a professor of cardiology, faculty of medicine, Alexandria University. Hello, doctor. How are you? What do you think about CardioAlex 2017?
I think CardioAlex 2017, every year there is a progress in CardioAlex at each level. The number of attendees, the quality of the educational material, and the program of the CardioAlex. Each year we are trying as an organizing committee to improve our content of the conference in order to deliver the best knowledge for the Egyptian cardiologists.
Okay. What did you present this year?
The presentations this year are different. I have chaired a live transmission from the International Cardiac Center together with Professor Oscar Mendiz in a difficult case with long calcified bifurcation lesion, which was treated with rotational atherectomy. As regards the sessions, we have today in the morning a CHIP forum. CHIP is a term meaning complex and high risk intervention in indicated patients, and this number of patients are increased nowadays. Patients with complex anatomy and high risk who are treated with PCI, and we have a dedicated session. We have in this session Professor Tarek Helmi, Professor Alfredo Galassi, Professor Taryn Collins, Professor Muhammad Sada, myself, and we address the different issues of CHIP patients who are a difficult subset of patients to be treated, and we showed how to manage this patient properly.
Okay. What's new in the field of intervention this year?
In the field of intervention this year, there are many new drugs which were introduced in the Egyptian market. In the last year, we have drugs for heart failure, drugs for hypertension, and antiplatelet drugs, which are now available, and we discussed the long-term benefit and short-term benefit of these drugs in the Egyptian people, in the Egyptian population, and the recent publications about these drugs. Secondly, there is new interventions as regards the use of the different techniques to treat patients with coronary artery disease with cardiac catheterization. The updates in the electrophysiology, updates as regards the use of CRT, CRTD, and ablation therapy in case of arrhythmias.
Okay. What is your opinion regarding the new bioabsorbable stents?
The new bioabsorbable stents, you all know that the recent data published in the last meetings shows that there is a higher risk of stent thrombosis in patients who are treated with the bioabsorbable stents, but these problems occurred in case of off-label indication. So if we are going to adhere to the label indication, to use it in the proper patients and to use the proper technique, I think this platform of VVS will have a good result. And also we have to wait for the ongoing trials and data now with other platforms which are improving and overcoming the limitation present in the first generation of the VVS.
Okay. Want to evaluate intermediate lesions using IVUS or FFR?
Intermediate lesions today, we have two examples of the use of imaging modalities and FFR in the CAS lab. Yesterday, Dr. Sada had a case, a live transmission from the ICC, and they used elegantly the FFR and to show when to select patients with intermediate PH in order to revascularize and to avoid the ocular stenotic reflex. Not every stenotic lesion we are going to treat it with a stent. The best is to evaluate the function of functional assessment of the ischemia. If there is significant reduction of the FFR, you have to stent the lesion. Also today in the morning, there is a live transmission from Alexandria University Hospital. The operator was Professor Tarek Helmi from USA, and Dr. Sharif Beltagi, Professor of Cardiology, University of Alexandria, and Dr. Mohamed Loutfy, a lecturer of Cardiology. And there was a case of LED lesion, and they assessed the lesion with an IVUS, and apparently it was an intermediate lesion, and they did not treat the patient with a stent after evaluation with the IVUS. So both the IVUS and FFR are used to refine and to select proper particularly the patient in whom we need to do further revascularization by stents.
Okay, thanks a lot,
Thank you.
doctor.
Thank you so much.
Have a nice day.